Hello and welcome. Thank you for joining me today for a quiet conversation about a topic that touches many of us, yet one we often hesitate to discuss: the subtle changes that can occur as we, or our loved ones, approach the later stages of life. Has life felt a bit different lately? Perhaps you've noticed some subtle shifts in yourself or someone you care deeply about, changes you can't quite put your finger on, but that feels significant nonetheless. Many people imagine that the end of a long life comes suddenly, but often the body sends quiet signals, gentle warnings, sometimes months or even a year or so before life reaches its final chapter. The challenge is, these signs can be easy to miss, especially at first. They might seem like small, everyday things, perhaps dismissed as just getting older. It's often only in hindsight that families realize the clues were there all along. Talking about this isn't meant to cause worry or fear. Quite the opposite. Understanding these natural processes can bring a sense of peace, preparedness, and empowerment. It allows us the opportunity to provide better care, to cherish meaningful moments, and importantly, to ensure that this final stage of life is filled with as much comfort, dignity, and love as possible. Today, we're going to gently explore some of these common, often subtle signs. We'll talk about what they might look like, why they might be happening, and most importantly, how we can respond with compassion and understanding. Think of this not as a prediction, but as shared knowledge to help navigate this journey with greater awareness. We'll discuss changes in energy and appetite, shifts in sleep and social interaction, how our bodies heal, and even changes in breathing. We'll also touch upon the importance of comfort, communication, and emotional well-being during this time. Our goal is to foster understanding, so you feel more prepared, less caught off guard, and better able to focus on what truly matters: connection, peace, and living each remaining day fully and with dignity. So let's begin this conversation together with openness and care. 1. Recognizing the gentle warnings. We'll start by looking at some of the physical and behavioral shifts that might become noticeable. Remember, not everyone experiences all of these, and the timing varies greatly from person to person. These are simply common observations. Sign number 1: changes in energy and activity levels. One of the most common changes is a noticeable decrease in overall energy. This isn't just feeling tired after a busy day, it's a deeper, more persistent fatigue that rest doesn't always seem to fix. You might notice yourself or your loved one needing significantly more sleep, perhaps taking longer naps during the day. Activities that were once routine might start to feel exhausting. Climbing a flight of stairs could leave you breathless, requiring a long pause afterward. Simple tasks like showering, getting dressed, or even preparing a small meal might suddenly seem overwhelming, taking much more effort than before. Perhaps conversations become shorter because sustaining focus feels draining. Maybe hobbies that once brought joy are set aside, not due to lack of interest, but because the physical or mental energy simply isn't there. It might feel like the body's internal battery just isn't holding its charge the way it used to. Why does this happen? As the body naturally slows down in the later stages of life, it begins to conserve its resources. Think of it like prioritizing essential functions. The metabolism might slow, meaning the body isn't producing energy as efficiently. Circulation might weaken slightly, so muscles don't get oxygen as readily. Sometimes, underlying health conditions also contribute to this profound fatigue. It's easy for family members to misunderstand this deep tiredness, perhaps thinking their loved one just needs to push through it. But forcing activity usually isn't helpful and can lead to frustration. The most supportive response is often acceptance. Recognizing and respecting these new limits is key. What helps? Adapting the environment can make a big difference. Maybe placing a sturdy chair in the shower for seated bathing. Arranging frequently used items within easy reach to minimize effort. Planning activities for times of day when energy levels are typically highest, and keeping them shorter. Most importantly, allowing for rest without guilt or pressure. It's about acknowledging the body's need to slow down and conserving energy for what matters most. Perhaps a quiet conversation, enjoying a favorite piece of music, or simply resting peacefully. 2. Changes in appetite and weight. Another common sign is a noticeable shift in appetite and, often consequently, unintentional weight loss. This can start subtly. Maybe clothes begin to feel looser, or a belt needs tightening by an extra notch. Perhaps someone who always had a hearty appetite starts eating smaller portions or skipping meals altogether. Food might simply lose its appeal. Familiar tastes can change, or the sense of smell might diminish, making eating less enjoyable. Some people report feeling full very quickly, even after just a few bites. There might be a new preference for liquids, like soups or nutritional drinks, or for softer foods that require less effort to chew and swallow. Losing weight without trying is often a signal from the body. As we age, some muscle loss is normal, but significant unintentional weight loss can indicate that the body isn't absorbing nutrients as efficiently as it once did. The digestive system might be slowing down, or the body might require less fuel as its overall activity level decreases. Underlying medical conditions, or even the side effects of certain medications, can also play a role in reduced appetite. Sometimes families worry and try to encourage eating more, preparing favorite meals or offering high-calorie supplements. While well-intentioned, forcing food when someone genuinely isn't hungry can sometimes cause discomfort or even nausea. What's often more helpful is shifting the focus from quantity to quality and comfort. Offer small, frequent meals or snacks that are nutrient-dense and easy to eat. Honor food preferences. If ice cream is appealing, then let that be okay. Ensure good hydration with water, juice, or other preferred fluids, as dehydration can worsen fatigue and confusion. Pay attention to mouth comfort. Dry mouth or dental issues can make eating difficult. Most importantly, respect their appetite. If someone consistently isn't hungry, acknowledge that without pressure. It's often a natural part of the body slowing down. If weight loss is significant or concerning, it's always wise to mention it to a doctor. But understanding it as a potential sign of the body's changing needs can help frame the approach towards comfort rather than force. 3. Increased need for sleep and social withdrawal. Related to the decrease in energy, you might observe a much greater need for sleep. This isn't just about feeling tired, it's about the body actively seeking more rest. Sleeping patterns can change quite dramatically. Someone might sleep for longer stretches overnight, sleep more soundly, or, conversely, sleep more lightly but nap frequently throughout the day. It's common to see individuals dozing off in their chair mid-morning or needing a long rest after even minimal activity. Alongside this increased need for sleep, you might notice a tendency towards social withdrawal. This doesn't necessarily mean the person cares less about others. Rather, interacting can become genuinely taxing. Following conversations, especially in groups, might require too much energy. Loud environments or busy social gatherings that were once enjoyable might now feel overwhelming or confusing. As a result, the person might become quieter, speak less, or seem content to sit in silence for long periods. They might decline invitations or prefer shorter visits. It can appear as if they are retreating into their own world. This isn't usually a conscious decision to push people away, but rather a response to the body and mind needing more quiet and rest. It's a way of conserving limited energy. For family and friends, this withdrawal can be difficult to witness. It might feel like rejection, or you might worry they are depressed, which is possible and should be considered, but withdrawal is also a common end-of-life sign. How can we best respond? Patience and understanding are crucial. Respect their need for quiet and sleep. Don't try to force interaction or fill every silence. Sometimes, simply being present in the room with them, quietly reading or sitting nearby, offers immense comfort without demanding energy they may not have. Short, calm visits are often better than long, overwhelming ones. Let them know you're there, offer a gentle touch if appropriate, but allow them the space and peace they seem to need. It's about meeting them where they are in their need for rest and solitude. 4. Subtle cognitive shifts. As the body changes, so too can the mind. It's important to distinguish these shifts from the more pronounced, progressive changes seen in conditions like Alzheimer's disease, although they can sometimes overlap. We're talking about more subtle, fluctuating changes in thinking and awareness that might appear in the final months or year. This isn't just the everyday forgetfulness that many of us experience as we age. like misplacing keys or forgetting a name momentarily. It might manifest as increased confusion, especially regarding time, place, or people. Someone might forget what day it is more often, seem unsure of where they are even in familiar surroundings, or momentarily confuse family members. You might notice difficulty following conversations, losing the thread easily, or repeating the same story or question multiple times within a short period, even if they've never done that before. Sometimes, there can be surprising moments of clarity mixed with periods of confusion, almost as if the mind is fading in and out of focus. Decision-making might become more difficult, even for simple choices. These cognitive shifts can happen for several reasons. As circulation potentially weakens, the brain might receive slightly less oxygen and nutrients than it needs to function optimally. Underlying infections, particularly urinary tract infections, UTIs, in older adults, can often present primarily as sudden confusion rather than typical infection symptoms like fever. Dehydration and medication side effects can also contribute. Witnessing these changes can be distressing for loved ones. It's natural to want to correct or argue when someone seems confused, but this often increases their agitation. A more gentle approach is usually better. Speak calmly and clearly. If they are confused about the day or time, gently reorient them. "It's Tuesday afternoon, Mom," without making a big deal of it. If they misremember something, often it's kinder to just go along with their reality in that moment, unless it's causing distress. Use simple sentences. Remind them gently of they become thinner and more fragile, making it more prone to tearing or breaking down, especially over pressure points like the heels or tailbone if mobility is limited. These slow-healing wounds require careful attention to prevent infection. Why does this happen? The immune system's effectiveness naturally declines with advanced age, but this can be more pronounced in the final phase of life. Reduced circulation also plays a role. Blood delivers the oxygen and nutrients needed for healing and fighting infection. So if circulation is less efficient, these processes slow down. Poor nutrition or hydration can further compromise the body's defenses and repair mechanisms. It's important to be aware that infections in frail, elderly individuals don't always present with classic symptoms like a high fever. Sometimes, the only signs might be increased lethargy, loss of appetite, or a sudden increase in confusion. Watching a loved one struggle with recurrent infections or slow healing can be frustrating. While medical treatment for infections is often necessary, the focus may gradually shift. Aggressive treatments might become less effective or cause more burden than benefit. Supporting the body involves focusing on prevention and comfort. Encourage good hygiene, like regular hand washing. Pay close attention to skincare. Keeping it clean, dry, and moisturized can help maintain its integrity. If mobility is limited, frequent repositioning helps prevent pressure sores. Ensure adequate hydration and nutrition as tolerated. And be vigilant for subtle signs of infection, seeking medical advice promptly, but always weighing the potential benefits and burdens of treatment in consultation with the healthcare team and considering the person's overall goals for care, which often prioritize comfort. 6. Changes in comfort and physical sensations. As the body changes, so can a person's sense of physical comfort and how they experience sensations. These changes might be subtle, but can significantly impact quality of life. One common observation is feeling cold more often, even when the room temperature seems comfortable to others. You might notice your loved one constantly wanting extra blankets or wearing sweaters indoors. This is often due to changes in circulation, less blood flow reaching the skin's surface, and a decrease in the body's metabolic rate, which generates heat. Thinning skin and loss of subcutaneous fat can also contribute. Pain perception might also change. Some individuals may become more sensitive to pain or discomfort. Old aches and pains might flare up, or new ones might develop. Conversely, sometimes sensory perception can decrease, meaning they might not notice minor injuries or pressure as readily. It's also possible that expressing pain becomes more difficult, especially if cognitive changes are present. Look for nonverbal cues like grimacing, restlessness, guarding a particular body part, or changes in mood. Restlessness is another sensation that can increase. Someone might find it difficult to get comfortable, constantly shifting position in their chair or bed. This can be due to pain, anxiety, breathing difficulty, or simply an internal sense of unease. What helps manage these changing sensations? For feeling cold, simple measures like offering warm socks, extra blankets, or a warm, not hot beverage can make a big difference. Ensure the room is free from drafts. For pain or discomfort, regular assessment is key. If pain seems present, discuss management options with a doctor. This might include medications, but also non-drug approaches like gentle massage, if tolerated and enjoyed, heat or cold packs, or simply finding a more comfortable position. For restlessness, try to identify any underlying cause. Are they in pain? Anxious? Need to use the restroom? Sometimes gentle reassurance, calming music, or a change of scenery, like moving to a different chair or near a window, can help soothe restlessness. The goal is always to maximize physical comfort. 7. Changes in breathing patterns and circulation. Towards the end of life, changes in breathing and circulation become more apparent and are often clear indicators that the body is significantly slowing down. Breathing patterns may change noticeably. Breathing might become much shallower or slower, with longer pauses between breaths. Sometimes breathing can become irregular. Periods of rapid, shallow breaths might alternate with periods where breathing almost stops for several seconds. This is sometimes called apnea. A specific pattern known as Cheney-Stokes respiration might occur, characterized by cycles of deep, rapid breathing, followed by slowing breaths, and then a pause. While these changes can look alarming to observers, they are often not distressing to the person experiencing them, as the brain's sensitivity to carbon dioxide levels changes. Shortness of breath, or dyspnea, can also increase, sometimes occurring even with minimal exertion like shifting position in bed or speaking a sentence. You might notice the person breathing more through their mouth or seeming to struggle to catch their breath. This can be due to weakening lung function, heart inefficiency, or sometimes fluid buildup. Changes in circulation often accompany breathing changes. As the heart pumps less strongly and the body prioritizes blood flow to vital organs like the brain and heart, circulation to the extremities decreases. This can cause the hands and feet, and sometimes the ears and nose, to feel noticeably cool or cold to the touch. The skin in these areas, or sometimes more generally, might appear pale, or develop a bluish or purplish tinge, especially around the lips and nail beds. Sometimes, a mottled, lace-like pattern might appear on the skin, particularly on the arms and legs. These are all signs of reduced peripheral circulation. Seeing these changes, especially in breathing, can be frightening for family members. It's natural to want to intervene, perhaps urging them to breathe deeper. However, these patterns are often part of the natural dying process. The focus should be on promoting comfort. Elevating the head of the bed or propping the person up on pillows can often make breathing easier than lying flat. Keeping the room cool or using a small fan directed towards the face can sometimes relieve the sensation of breathlessness. Offer reassurance in a calm voice. If they seem anxious, simply holding their hand can be comforting. Oxygen therapy might be used, but typically for comfort rather than to reverse the underlying process. Keeping extremities warm with socks or blankets can help if they feel cold. Understanding these changes as part of the body's final journey can help families respond with calm support rather than panic. Understanding the why and the natural process. So, we've talked about some of the signs you might observe. Now let's spend a few moments understanding the broader context. Why do these changes happen? It's crucial to remember that this is usually a gradual process. It's rarely like flipping a switch. The body, after a long life, naturally begins to slow down its functions. Systems that have worked tirelessly for decades become less efficient. It's not necessarily a sign of failure, but rather a natural winding down, a conservation of energy. Think of the body's incredible wisdom. As it senses its energy reserves are diminishing, it starts prioritizing. Core functions needed to sustain life are maintained as long as possible, while others, like robust digestion, rapid healing, or high energy output for activity, become secondary. This redirection of energy is behind many of the signs we've discussed: the fatigue, the the decreased appetite, the slower healing. It's also important to distinguish these gradual changes from acute, sudden illnesses. A sudden spike in fever, intense pain, or abrupt confusion always warrants medical attention, as it could indicate a treatable condition. However, the signs we're discussing today often develop more slowly, over weeks or months, reflecting a deeper systemic shift. Sometimes an acute illness can accelerate this underlying process, but the gradual decline itself is different. This understanding leads us to the philosophy behind palliative care and hospice care. Sometimes people hear these terms and think it means giving up. That couldn't be further from the truth. Palliative care, which can be provided at any stage of a serious illness, and hospice care, typically offered when curative treatments are no longer the focus or desired, are both centered on maximizing quality of life. Their primary goal is comfort, managing symptoms like pain, shortness of breath, nausea, or anxiety effectively. But they offer much more than just physical symptom management. They provide emotional, spiritual, and practical support for both the person and their family. They affirm life and regard dying as a normal process. They focus not on extending life at all costs, but on ensuring the life that remains is lived as fully, comfortably, and meaningfully as possible. Understanding that these supportive approaches exist can be a great source of comfort and help when navigating this stage of life. They embrace the body's natural process with compassion and expertise. Practical steps for comfort and support. Knowing the signs and understanding the process naturally leads to the question, what can we do? How can we best offer support and comfort during this time? Often, the simplest things make the biggest difference. First, consider the environment. A calm, peaceful atmosphere can be incredibly soothing. Reduce clutter and noise where possible. Surround the person with familiar, cherished objects, photos, a favorite blanket, perhaps soft music they enjoy. Ensure the room temperature is comfortable for them, remembering they might feel colder than others. Good lighting, avoiding harsh glares, is also helpful. Communication remains vital, but it might change. The most important aspect is often listening. Really listen not just to the words, but to the feelings behind them. Listen for expressions of wishes, fears, or needs. Sometimes, though, words aren't necessary. The simple act of presence, sitting quietly beside them, holding their hand, offering a gentle touch, can communicate love and support more powerfully than any words. If they want to talk, follow their lead. Don't shy away from difficult topics if they bring them up, but also don't force conversations they aren't ready for. Gentle honesty is usually best. If they ask questions about their condition, answer simply and truthfully, but gauge how much information they truly want. Encouraging life review can be a wonderful source of comfort and affirmation. Look at old photographs together. Ask them to share stories from their past. Reminiscing about accomplishments, relationships, and meaningful experiences helps validate their life and legacy. It reaffirms that their life mattered and continues to matter. Beyond the emotional support, pay attention to basic physical comforts. Dry mouth is very common, especially if breathing through the mouth. Offer frequent small sips of water or other preferred liquids. Use lip balm. Special swabs can help keep the mouth clean and moist. Skincare is also crucial. Gentle cleansing and moisturizing help prevent dryness and breakdown. Ensure clothing is soft, loose, and comfortable. Help them find comfortable positions, using pillows for support as needed. These small acts of physical care convey deep respect and tenderness. Emotional well-being and making memories. Navigating this stage of life involves a profound emotional journey, both for the person experiencing the changes and for those who love them. It's essential to acknowledge and honor these feelings. It's perfectly normal to feel a mix of emotions, sadness about the changes, perhaps fear of the unknown, anxiety, or even moments of peace and acceptance. For family members, there might be anticipatory grief, grieving the losses that are happening even before death occurs. There might be feelings of helplessness, guilt, or simply overwhelming love. Allow space for all these feelings without judgment. It's okay not to be strong all the time. Talking about these feelings with trusted friends, family, or a counselor can be very helpful. During this time, focusing on the present moment becomes incredibly valuable. While the future may feel uncertain, the now offers opportunities for connection. Cherish the small, simple moments, the warmth of a shared cup of tea, the sound of birdsong outside the window, the comfort of a familiar melody, the simple act of holding hands in silence. These moments of connection become precious memories. Thinking about legacy can also be comforting. This doesn't have to be about grand achievements. Legacy is about the impact a person has had on others, the love they've shared, the values they've passed on. Help them feel their life has meaning. Share specific memories of how they've touched your life. If they are able, perhaps help them write down thoughts, stories, or messages for loved ones. Knowing their life story is valued can bring immense peace. And for those providing care, whether family or friends, remember to care for yourselves too. Caregiving during this time is emotionally and physically demanding. It's not selfish to take breaks, accept help from others, eat well, get rest, and seek support. You cannot pour from an empty cup. Finding support groups, talking to friends, or seeking professional guidance can help you navigate your own emotional journey, allowing you to continue providing compassionate care.